Hello there and welcome to GITEX Global. As you can see, we are literally recording this live from the shop floor. Fortunately, the event hasn't actually opened yet, so there's not the thousands of people that you normally see. But I come here early, and my wonderful guest has also come here early, so that we can talk about a really, truly extraordinary futuristic reality. Matt Angle is the CEO of Paradromics, which is a neural brain chip company. First of all, Matt, I mean, that on its own sounds absolutely extraordinary. Can you explain to me what exactly your company is looking to do?
Yeah, absolutely. So I have a brain-computer interface in my pocket today. This is the highest data rate brain-computer interface in the world in your hand right now. So what's really interesting about a brain-computer interface is it is basically a modem for the brain. It can pull out data from the brain and make it accessible to a computer, or the opposite, make data from a computer accessible to the brain. So why would you do this? A lot of people suffer from injuries where, let's say, they lose the ability to see or they lose the ability to move, and we can't restore the biology. There's no regrowing an eye or regrowing a spinal cord, and the cure for those kinds of conditions could be decades away. But what we know about the brain is it's fundamentally a data organ, which means that everything that you see, it really exists as data in your visual cortex. Everything that you do originates in your motor cortex as a signal. So if we have a brain modem that can plug into the brain and understand the neural representations of motor and vision, then we also have something that can be used to allow paralyzed people to speak again or use a computer, or allow blind people to see again. It's taking these really hard problems from the biology domain where we're not close to solving them and moving them into a technology domain where we can fix them.
This seems like a silly question because I'm quite literally holding it. But how real is this? At what stage are you at from a perspective of testing?
So this device in your hand, we've implanted in more than 100 sheep and one person.
Okay.
And so what we've learned from implanting these in sheep is that these devices can record signals stably in a large animal's brain for more than 3 years without losing any signal fidelity. We've learned that we can pull through this interface up to 200 bits per second, which, just to put it in context, is more data than you need to restore speech and 20 times more data than Neuralink has ever demonstrated, Neuralink being Elon's well-known company. And so what we've demonstrated in our one human participant that's allowed us to implant one of these devices in his brain is that we've shown that these devices can insert in human brains the same way they've inserted into sheep brains, and we can record signals. And now we're getting ready for a clinical trial that'll start early next year where we restore speech for someone who is paralyzed.
Where are you planning to do that early clinical trial next year?
We have 3 universities that will be part of our trial. UC Davis in California, Mass General Hospital in Boston, and the University of Michigan and Ann Arbor.
So those will be happening in the United States. Those tests will be happening in the United States. But your funding isn't just from the United States, is it?
No, actually, we have investors from all around the world, including here in the MENA region from NEOM, which is a subsidiary of Saudi Arabia's Public Investment Fund and involved in a really ambitious and exciting construction project to build a de novo city in northwest Saudi Arabia.
Wow. So you have actually got funding from the Middle East then. And how much seed funding have you had so far? Because the R&D on this must be immensely expensive.
So to build this device and get to where we are that we're ready to launch a clinical trial, we've raised in total about $140 million.
Are you going to need more?
Well, we will raise more money before we bring the device to market. And also, we don't plan on stopping with the device that's in your hand. We see ourselves more like, Intel back in the heyday of Intel, or NVIDIA today, where we'll be releasing new devices every, let's say, 3 years, and each one of those devices will be twice as capable as the one that came before it.
So how long are you expecting the clinical trial phase of this to last? Because until that's finished, you can't start making a profit.
Yeah. So our first device, the one that you're holding, will go into a clinical trial next year that has 12-month endpoints. And then we'll begin that's our early feasibility trial. And then we'll begin what's called our pivotal trial, which is where we work with the US FDA to get approval to sell the device. I would expect that approval to sell the device comes sometime around the end of 2030.
Where is this going? Like, obviously, initially, you're looking to help people who can't speak. There's about 15 million or so people in the world right now who struggle to speak, and this is going to change their lives. But at what stage do you think you might start implanting it into people's brains, people who don't have any difficulties with speech or anything at all?
So what I'll say is that, in over the long arc of brain-computer interfaces, a brain-computer interface of sufficient data rate could provide data to the visual cortex that is indistinguishable from normal vision. For blind people, that would mean having 20/20 vision. For sighted people, that would mean being able to turn on a completely immersive AR or VR experience that would be indistinguishable from reality.
Inside your head.
Yes. And we're going in that direction. Brain-computer interfaces will eventually afford that kind of capability. Now, what I'm personally very excited about is between now and then, there are going to be a lot of what economists call externalities, but there'll be positive externalities. All of the money that's flowing into venture right now to build that kind of exciting, wild future of BCI is being used to create therapies today for some of our most difficult conditions, like paralysis, blindness, deafness, even treatment-resistant mental health. Because the device that you're holding in your hand, it doesn't just read out sensory and motor, it also reads things like mood and cognitive. And so when we can read out signs of mood disorder or signs of neuropsychiatric disorder, we can start to close the loop better on traditional medications or even neuromodulation that's available today in the lab.
And it sits on the surface of the brain, and then how does it talk to the brain?
So that device has 421 platinum iridium microwires that are each smaller than a human hair, and they penetrate down into the brain about 1.5 millimeters, and they can record from individual neurons. And in brain-computer interfacing, recording from neurons is the currency of information. The more neurons you record from, or the more neurons you can stimulate, the higher data rate your modem.
Concerns about safety. There must be a few. And there's two, right? First of all, there's the medical concerns that you might hurt the brain. And then looking ahead, there's ethical concerns, potentially. That the implications are manifold.
For certain. It is brain surgery to get a brain implant. And so it's not something that we take lightly. And that's part of our commitment in building brain implants, is that we want to build a device that will last for the patient or ultimately the user as long as they want to keep the device. That's part of Paradromics' ethos about building these devices. It should be safe to put in, and then it should last for a long time so you don't have to have a repeat surgery. Okay. On the other side, on the ethics of building these devices, I think that we have a chance to do it right. You can see with smartphone technology and with social media apps an example of where tech developers really weren't thoughtful in the way that they developed the technology. I mean, most of us are less happy when we have our phone on and facing us. And we live in a world where we're just pummeled with notifications, and many of the apps that we think that we're the customers for were actually the products, and we're essentially being used by the technology rather than being users of it. But I think with brain-computer interface, there's a chance now for the companies that are building it to benefit from the sort of negative examples that happened a generation ago and now build something that will be more affirming to what it is to be human rather than disabling.
You mentioned that you're not the only company doing this. Of course, a lot of people have heard of Elon Musk's Neuralink.
Yes.
If nothing else, he's amazing at grabbing the headlines. Are there more companies than that involved in this?
There are a handful of companies now that are building different technology solutions for trying to get data in and out of the brain. But I would say that Neuralink and Paradromics stand out above those other companies as being the two that are focused on recording and stimulating a lot of neurons simultaneously in a completely wireless system. And so that's kind of what's come to be defined as a high data rate brain-computer interface. And it's the platform that everyone will want to use as they move from the most basic applications to the more advanced ones.
Things are moving fast for you guys. What are you most excited about in the coming months?
I'm most excited that next year someone is going to use this device to talk to their family again.
Extraordinary. Matt, thank you very much
Thank you.
indeed. It's been an absolute pleasure. Thank you for your time.
Thanks.
I'm going to give you that back now.
Yes.